Hello and welcome to the Colorado Department of Public Health and Environment Hazardous Materials and Waste Management Division Healthcare Facility Self-Certification Checklist. This is a short video tutorial to help you understand how to fill out your annual self-certification checklist, which is done each year during September. The department sends out notifications via email, the portal, and regular mail, but please bear in mind that our ability to contact each facility depends primarily on the accuracy of the information we have on file for your facility here in the Hazardous Waste Division. So let's take a look at the first page. This page is asking for your basic facility information: current facility name, your EPA ID number, which is provided to you in the letter we send out to each facility, and typically begins with COR or COD followed by 9 numbers. Your EPA ID number is your tracking number in our system and is essential to enter correctly when you fill out this form. The next line is the physical address. Some facilities have multiple addresses attached to a single facility due to the size of the building. Please determine the correct mailing address for your facility and then use that address consistently each year you submit this form. If you have filled out a form in previous years, please check the accuracy of your address and compare that to your previous submissions and make sure that your address here is accurate and consistent. The remainder of this page is asking for your contact information. Please make sure your email and phone numbers are accurate. This is our primary means to keep up-to-date contact information for your facility. We ask for a backup contact so we have a second opportunity to let your facility know about the self-certification next year in case you leave your position. The next page includes instructions. Please read through them and then click the acknowledgement. The next section begins questions focused on your waste management. What's important to know here is that you are being asked questions that require either a yes, no, or not applicable response. So let's take the first question, which is asking whether your facility has made hazardous waste determinations for your waste. If you've identified all of your regulated hazardous waste at your facility, you would answer yes. If you haven't identified all of your regulated haz waste, you would answer no. If you do not generate any regulated hazardous waste, you would answer NA. If you're not sure, you can start with our training video located on our website for VSQG, that's Very Small Quantity Generator Healthcare Facilities, which takes approximately 40 minutes to complete. Bear in mind that the purpose of these questions is not to identify violations for the department to use to target a facility for an inspection. That's not how this works. The purpose is for you to identify where you're out of compliance, indicate that on this form, and then indicate what you will be doing to remedy the non-compliance at the end of each section. Once the certification process is complete, the division will conduct random follow-up inspections to ensure the data we've received is accurate, so be sure to fill out your form correctly and fix any deficiencies you've identified during this process immediately. The next question is a good example of something that will not apply to all healthcare facilities, and that's surgery. A long-term care facility, assuming they do not perform surgery, would answer this question as not applicable or NA. However, hospital or ambulatory service facilities would need to answer either yes, they have evaluated their surgical waste for proper hazardous waste disposal, or no, they have not evaluated that waste. If you've answered yes or NA to this question, simply move on to the next question. If you've answered no, be sure to indicate in the empty box at the end of the section what your remedy will be, which in this case would be to evaluate your surgical waste and determine whether any of that waste is subject to Colorado hazardous waste regulations. The third question is asking about whether you have a contract with a disposal vendor and whether that contract includes specific language regarding Colorado hazardous waste disposal. Bear in mind, we're not asking about biohazardous waste here. That's typically not a Colorado hazardous waste. So be sure to look at your contract and ensure it also specifically covers hazardous waste disposal. The fourth question asks if you're aware that using a commercial disposal system such as a drug buster or similar product does not change the direction of hazardous waste disposal in Colorado. In other words, even though the label may indicate you can mix your waste with the contents of the container and then dispose into the regular trash, be aware that is not consistent with Colorado law. That's true for hazardous and non-hazardous waste pharmaceuticals. It's not illegal to use these products, but the use of these products do not change the direction of final disposal. Hazardous waste mixed with those products are still a hazardous waste requiring hazardous waste disposal. Same is true if mixing your non-hazardous pharmaceutical waste with these products. If you need more information, this topic is covered in our frequently asked questions and training video on our website. Click yes if you are using these products but still doing proper disposal. Click no if you are using these products and then sending it to the regular trash or down the drain. If that's the case, include a short description in the empty box below of how you're going to remedy this disposal violation. Click NA if you do not use these types of products at your facility at all. The next two questions, number 5 and number 6, require that you identify the name and address and, for the hazardous waste question, the EPA ID number of the final destination facility for your waste. This is not asking for you to identify which transporter you use, but rather where your transporter is taking the waste for disposal. You'll get this information from your waste transporter. Remember, from a regulatory perspective, this is your facility's waste, not your transporter's waste, even after they take it off your property. It's important to confirm that the final destination is a facility that can accept this type of waste. Enter the information requested for your hazardous waste in question number 5 and your non-hazardous pharmaceutical waste in question number 6. A quick note. I've heard people say their transporter wouldn't give this information, but bear in mind, this is your waste and it is each facility's responsibility to ensure proper disposal of their waste. You are paying for your disposal service and you absolutely have the right to know where your waste is being disposed. This is not confidential information and neither is the final destination facility's EPA ID number. Questions 7 through 12 are relatively straightforward questions requiring a yes if you're in compliance, a no if you're not, followed by an explanation in box number 13, or NA if the question does not apply to your facility. Section B is the waste stream description section. You'll notice there are 3 categories of waste, including haz waste pharmaceuticals, solvent hazardous waste, and other hazardous waste categories. For each, you're being asked how much you've generated during your busiest month from the previous September to this past August. That's the 12-month period we are evaluating in this self-certification, and the total amount generated during the same 12-month time period. Where will you get this information? A couple of possibilities include using your own weight tracking logs or contacting your disposal contractor to obtain that information. For those facilities that are new to this self-certification process, the department realizes that you may not be completely prepared to answer this question accurately, so please provide the most accurate answer that you can, given it's your first time. However, plan for the next year by solving how you are going to capture this information going forward so you can answer accurately for subsequent annual self-certifications. A few comments here. If you are a long-term care facility, you likely do not use F-listed solvents, so you would simply put a 0 in the amount boxes. For those facilities, such as hospitals, that likely do use F-listed solvents, this is where you would capture those amounts. When inputting numbers, you'll input in pounds and use numbers only. During follow-up inspections, we verify this information with your disposal documentation, so be sure to be accurate. The other haz waste category is for non-pharmaceutical hazardous waste, but do not include universal waste here. Just other waste like ignitable liquids such as cleaners, corrosive such as an acid or a base, or toxic hazardous waste that are not classified as a pharmaceutical but require hazardous waste disposal as examples. Section C is asking about used oil management. If you do not generate used oil at your facility, the answer would be NA. Otherwise, answer appropriately. Box 5 in this section is for any no's that you've identified in the questions above and explain how you will come back into compliance. The last section is your signature certification and inputting your email so you can receive a copy of your certification once you press send. Be sure to read this section carefully. Also, if you don't receive your certification via email, be sure to check your spam or email security as the attachment may have been snagged before it hits your inbox. Lastly, if you need more technical guidance on Colorado's hazardous waste regulations, be sure to check out our training video as well as our FAQs and other supporting documents located on our website. If you still have questions, please call our technical assistance hotline. Thank you.